I'm Bruce Marshall. This is the Brampton Now update for the April 24th, 25th weekend, 2021. Coming up, Dr. 𝗕𝗺 sounding as grave as ever. On the other hand, though, great news about vaccine delivery into arms from our chief medic. And plans for the future on that front in Brampton. Plus, Peel's chief medic is starting to make Section 22 orders this weekend. We'll have a look at what that is and how we got there. Sun, cloud with temperatures in the mid-teens through the weekend. Rain and temperatures in the 20s coming in the next week, according to Environment Canada. Full current Brampton forecast at the link in comments. This is the Brampton Now update. Here's what's happening in Brampton. Dr. 𝗕𝗺 with the state of play as of Wednesday morning.
This is, unfortunately, the crisis that we feared. The patients fighting for their lives are our most vulnerable, our elderly, but also our essential workers who are increasingly younger and are often our newest Canadians and our racialized residents. Healthcare providers from across the province, including a friend of mine from Sudbury, continue to flow into our community to assist. But when the hospital beds run out, care will suffer, not only for COVID-19 patients, but for anyone who needs emergency help, life-saving treatment, or surgery.
All this against a backdrop of...
And this is all occurring while our cases continue to rise without pause, which speaks to our critical need to continue to stay closed, to continue to vaccinate, and then to exit.
So while we do the right thing by staying home as much as possible, the vaccine campaign is ramping up again and again.
In our vaccine campaign, we are now administering nearly 12,000 shots a day at our mass immunization clinics, which is nearly 100,000 doses per week, with our mobile clinics included. Yesterday, we reached a milestone of 400,000 doses in arms in Peel, and we continue to push forward rapidly.
In Brampton, by the Wednesday press conference, Mayor Brown announced that they were calling in the troops. Brampton Fire and Emergency Services will train at 𝗕𝗺 and will assist in the administration of vaccines.
We are excited to announce that in the coming weeks, our firefighters from Brampton Fire and Emergency Services will be partnering with the William Osler Health System to assist in the vaccination effort by helping to vaccinate our residents. Our firefighters are nimble. They've got significant training in public safety, and there'll be more details on this rolled out.
Seen here on Monday night at one of their more traditional calls. This is the 410 southbound from Steeles west on Monday night, just before dark, when a flipped tractor trailer caused the response of Brampton Fire and Emergency Services hazmat team. Nobody was injured either in the incident or the aftermath, including the driver, who has been charged by the OPP. Someone with a similar tractor trailer pulled the same stunt at almost the same spot a few nights later. It's like it's the meeting spot now for the Dum Dum Club. We can make a tractor trailer fly. But no, probably not a good idea. In a moment, a Section 22 order. What's the order and what is Section 22? More on that next on the Brampton Now update.
Hello, I'm Mayor Patrick Brown, and I am one of the many faces against parental alienation. Being a face against parental alienation means I've joined the fight against domestic violence, child abuse, false allegations, and parental abductions. You too can join the fight and campaign with us by wearing royal blue April 25th in support of Parental Alienation Awareness Day so that we can all be a voice for the voiceless.
There are some things you just don't do halfway. Fighting COVID-19 is one of them. As vaccines roll out, let's keep giving this our all and continue to follow public health measures. A message from the Government of Canada.
This is the Brampton Now Update. I'm Bruce Marshall. All week long, there's been talk of the chief medic in Peel invoking a Section 22 order. The order states basically that workplaces that have 5 or more employees with cases of COVID-19 in Peel could be shut down for 2 weeks and have their names published on the Peel Public Health website. How shut down? Well, as we have seen in other areas, the chief medic would have the authority to fence the property and have police guard them. Workplace spread continues to be a problem in Peel. So this is the chief medic using extraordinary powers under provincial health legislation. Reading between the lines here, this is the chief medic quite rightly using the nuclear option under legislation when the province didn't take enough action on spread of the virus in workplaces. When you listen to the chief medic talk on these issues, he never says anything like, the provincial government needs to. No, the most he would say on that is that more and more stringent workplace labor inspections are needed from both the province and the feds. But the doctor is a public servant, not a politician, and he can't slug it out in the press with the Premier or the Prime Minister the way, say, the Mayor could. As my West African friends would say so aptly, Lowe has to play his politics small, small. Because of his position, his comments can never sound even close to personal, must always be professional. But we had some context on this from Dr. 𝗕𝗿𝗺𝗺𝗺𝗺, the epidemiologist who has been an outspoken critic of some of the provincial government's moves. In a piece this week in the Toronto Star, Dr. 𝗕𝗿𝗺𝗺𝗺 was quoted as characterizing the move by Lowe as needed on the one hand, but a bit of a mutiny against the province on the other. 𝗕𝗿𝗺𝗺, saying what Lowe can't, explains to the Star that Lowe is using this extraordinary power because he hasn't got the tools from the province that were needed to deal with workplace spread. And so what does Section 22 actually say? We know what the order is, but this section of Ontario health law is meant for dire situations, and we're in a dire situation, according to the chief medic. Under Section 22 of the Health Protection and Promotion Act, a medical officer of health can issue an order, quote, to require a person to take or refrain from taking any action in respect of a communicable disease. Think about the scope of that for a moment. It's a sign of where we are. The legislation and the plans for the pandemic were not dreamed up overnight. They've existed for years. In fact, Brampton's emergency planning chief, Alain Normand, was an architect of the national pandemic plan as it was written some 20, 30 years ago. So in the clear light of day, when a pandemic wasn't raging, legislation was put together, and it included powers that could be used in the most dire circumstances, and that's where we are with the chief medic invoking the extraordinary yet quite appropriate powers that he has. Who is Dr. Lowe? Well, I think if we were to mold a chief medic out of plasticine to match the challenges that we are facing right now, it would look like Dr. Lawrence Lowe, steeped in public health knowledge with a specialty working on communicable disease outbreaks. A board-certified physician in Canada and the U.S., he's worked in all 3 levels of government and has lectured in public health at the University of Toronto Medical School. For this moment, he's a singularly appropriate choice. For more on Dr. Lowe and his extraordinary use of the Section 22 powers at his disposal, Dr. Lowe was a guest on TVO's The Agenda with Steve Paikin this week. A candid interview with a guy who doesn't mind asking tough questions, with a guy who is about honest answers, I think. The interview is at the link in comments. In a moment, spring is on the way and babies popping out in the council chambers like the fresh flowers of spring. This sounds a little weird, doesn't it? Anyway, more on that coming up next on the Brampton Now Update.
Teens are dying of overdoses every day. Stigma is making it harder for people to get help. Addiction is a treatable medical condition, not a choice. Help end the stigma. A message from the Government of Canada.
I'm Bruce Marshall. This is the Brampton Now Update. Sunday will mark the Day Against Parental Alienation. Started by Brampton activist Cheffinessa Brown, the movement calls out parents who for no reason demonize their co-parent in a split-up. The movement calls this out for what it is, child abuse. At a time when kids' lives are already shattered by the breakup of their parents, they have the added pressure of having to take sides. This is wrong, the movement points out. Brown started with her first flag raising on April 25th in Brampton last year with much less ceremony and speeches. Flag raisings will quietly happen on Sunday this year in Brampton, Mississauga, and Toronto, as they will in several other locations around the world where this Brampton-based movement has touched lives. Wear royal blue on Sunday to stand against parental alienation. Mayor Patrick Brown and his wife Gigi, Genevieve Gaultier-Brown, celebrated the arrival of their first daughter, Savannah Francesca, a sister for young Theodore. Not to be outdone, though, Regional Councillor 𝗕𝗿𝗺𝗺𝗃 and his partner, 𝗕𝗫𝗃, announced the arrival of their first child. It's raining girls at Brampton Council. Hey, is song... No, I guess the Raining People song has already been done, hasn't it? Oh, well, and that's the Brampton Now Update for this week. Please subscribe to the Brampton Now Update channel on YouTube at the link in comments or follow #MarshallMinute on Facebook. The Brampton Now Update is your weekly reliable source for all things Brampton, unbought and unbiased. Your comments and suggestions always welcome, and if you've got a Brampton story to tell, get in touch with me through the channel you're watching on right now. Special thanks this week to Pascal Marchand at the4kguy.com for providing stunning video of Brampton Fire and Emergency Services operating at that hazmat scene this week. Stay strong, Brampton. Brampton strong. We're all in this together. I'm Bruce Marshall. Thanks for watching Brampton Now Update.
Quiet, numbskulls. I'm broadcasting.